Alright guys, so this is going to be my third video out of 4, which is the... Yes, I'm recording. Which is the Piggyback. Oh my god. Assuming that we have a primary line with saline solution flowing. So, first thing I'm going to do is I'm going to go ahead and check my doctor's orders. Make sure nothing is abnormal, and make sure that I have the right patient and the right medication and such. Alright, so the first thing is I'm going to go ahead and do my vancomycin, which is an antibiotic, aminoglycoside, and what it does is it binds to a cell wall and thereby lysing the wall, and that's how it kills it. It is very effective against the gram-positive bacteria or pathogens, and the symptoms and side effects are nausea and vomiting, ototoxicity, nephrotoxicity, and hypotension. Now, recommended dose is 500 milligrams every 6 hours and 1,000 milligrams every 12 hours, up to 4 grams a day. Contraindicated to people who has hearing, renal impairments, and hypersensitivity. Now, IV is available in 500 milligrams, 750 milligrams, vials in 1 gram, 5 grams, and 10 grams. And it is particularly important to note that when you're trying to, cure the C. diff pathogen or kill them, you have to take the antibiotics orally. And until then, any other bacteria that you have, you might want to give as an IV to effectively kill them. So, first thing is first, I'm supposed to draw out my medication. I already did that, just for this purpose. And just like the last video, I have already done my IV calculations. So, this is a 50 milliliter bag, but I will assume that this is 100 milliliter. And overall, the doctor's order is 500 milligrams every 6 hours. What I have is 500 milliliters 500 milligrams per 2 milliliters. So I drew up 2, and the drops per minute is going to be 1. Okay, so let me do my hand hygiene first real quick. Go ahead and I'm going to wipe the port. Now putting 2 milliliters of vancomycin in here. Going in well. Take this off. Go ahead and shake it real quick. This is good. Here's my secondary tubing. Make sure you label your medication with the right medication, dosage, the patient's date, time, and initial. Also, with the tubing, date, time, initials, and that's right. Yeah. All right. So, assume that this is flowing. What I'm going to now do is prime. Let me go ahead. Take this off. Make sure it is locked. Here we go. I'm going to go ahead and put this back. Attach it. Okay. Slowly, I will prime. Slowly. Okay, here we go. This is good. Now it's primed. And this is sterile on the bottom. So I'm going to take everything to the patient's room and do my hand hygiene. And then I'm going to go inside and introduce myself, do the 2 identification, which is the birthday and the patient's name. I'm going to go ahead and explain the procedure, what I'm about to do. I'm going to tell the patient that I'm going to go ahead and apply the medication through this bag, and tell the patient any side effects of the medication and what the patient should know. So looking at the arm, I'm going to go ahead and look for phlebitis or any infiltration. any tenderness or redness. I don't see it. So now I'm gonna do my hand hygiene and apply my gloves. All right, first things first. We'll go ahead and lower this medication. Cut the one on the top. All right, so this part is still sterile. So what I'm gonna do is stop the flow right here for the primary line. So clamp it. And then after that, I'm gonna have to clean the port of the primary line. Clean it. This one was supposed to have a cap, so I'm gonna assume that this had a cap, which is a piggyback, and go ahead and attach. Now the primary is already stopped. So what I'm gonna do is this one right here, loosen this. Oh wait, no, this is not supposed to go. I'm gonna say that I cleaned it again. It's supposed to be the bottom one here. Yep, good. That's good. And what I'm gonna do is start releasing my medication and calculate my drop factor, which was 1 drops per minute. And let's say I am doing that right now. 1 drop per minute. Medication is flowing. And I'm gonna go ahead and check for any distension. Okay, I don't see it. Alright, so I'm gonna wait till the medication is done, take my gloves off, do my hand hygiene, and then leave the room. I'm gonna come back. I come back and I see the medication is done. So what I'm gonna do is do my hand hygiene, put my gloves on, and stop this flow. The piggyback. So you can take this off. Yeah, I'm gonna check one more time for any signs of filtration or phlebitis. I don't see it. Okay, so this, I'm gonna have to reestablish the flow rate. Unlock it. Okay, and I would of course do this as how it was flowing like before. Okay, so this is good. All right, so now what I'm gonna do is everything's good, right? Take this off. Do my hand hygiene one more time. I see no signs of inflammation or phlebitis in the arms, so that's good. And what I'm going to do is go ahead and document on the computer, which is based on my medication administration record, the dosage, the route, how much, what was the medication, time, date, patient's initials, my initials, also how the patient handled the procedure, and intake and output for the patient for the procedure. And that'll be all. So I think yeah.